webinars and the face-to-face meetings that we're going to do to continue this group and to have all of us working together and achieve some of these common goals. So thank you for taking the time to do that.
I want to just tell you a little bit about this board. 10 years ago, the PALS concept was developed with the help of GlaxoSmithKline in recognizing that people who are advocates for health and health care, improving health and health care, have a common agenda. And that agenda is really about how to be effective patient advocates. And I think PALS was born on trying to help create this network of patient advocates and improve patient advocacy leadership as a vehicle throughout the country. You are part of a movement that's going on, not quite like Occupy Wall Street, but maybe someday we'll have that notoriety. This is really an opportunity for patient advocates throughout the country to come together to participate in these summits. We've held 6 of these in the past year, and we plan to hold more as we move forward into the next year. And I know the work that you'll do here today and the work that you'll do in your communities in Florida will pay off in improving the quality of health care and health of the people that you work with.
Next, I have the pleasure of introducing our keynote speaker, and he really doesn't need any introduction because if you watched the news recently, he's been on quite a few channels on national networks. Mr. Ron Christie is the founder and the president of Christie Strategies. He's a senior political strategist, he's a commentator, he's an author, and he's a former domestic policy advisor for President Bush and Vice President Cheney. And he recently completed a fellowship in the Institute of Politics at Harvard University. So that's just a quick snapshot of some of his background, but he's a brilliant strategist, and with the political season that we're in right now, full steam, he's going to be extremely busy. So if you didn't know his face before today, you're going to know it because you'll see him on quite a few channels. So let's welcome Ron Christie.
Thank you very much for that warm introduction. I really appreciate the opportunity to be here. It is the Patient Advocate Leadership Summit for a reason. This is run by, for, and to advance the cause of patient advocates all across the United States. And as a recovering lawyer, as a recovering lobbyist, and a recovering congressional staffer, I can tell you the impact of hearing directly from constituents, from patients, from people who have had a wide variety of ailments, a wide variety of health issues, wide variety of health disparities. It's so much more important to hear your voice, your input, and frankly, how our leaders should be responsive to the needs of your communities makes such an amazing impact. So I thank you from a personal perspective for what you do. Also professionally for you, this is the opportunity for you to engage with people across the South, here in Florida, across your particular region of the country, to learn, to exchange new ideas, to find out what's working best for you, and also what isn't working. I think a lot of people in Washington just have the sense that we know what we're doing best, we have the great idea of how things should work, but they don't take the time to listen to their constituents in the manner that they should. And by having these regional events, by having the opportunity to exchange best practices, and also having the event to talk about what doesn't work, that will give you the opportunity to leave Orlando and to leave and to go back to your home and your regions and your constituencies, not only energized, but also in a position to best put the information gathered and gained here into action as you work with your state representatives and folks at the national level. All right? But that you're united solely for the particular reason of helping other people and helping your constituents and helping folks that you know and you love and you work with. And that's kind of the theme of my remarks that I wanted to share with you this morning. There are 3 specific areas that I wanted to talk about. with you this morning. One, of course, is the implementation of the Patient Protection and Affordable Care Act itself. How do we implement a piece of legislation, obviously one of the biggest pieces of legislation, and also one of the most controversial pieces of legislation since the programs of the Great Society in the 1960s. So I want to talk about that. Second thing I want to talk about is, of course, the political fallout and the legal challenges that face implementation of this bill. What are policymakers across the states, what are policymakers in Washington doing to either implement or block implementation of the Affordable Care Act? And concurrent to that, what's going on in the courts? You've seen a number of legal challenges at the federal district court level, the circuit court level, and of course, obviously, the Supreme Court of the United States, which will hear arguments about the legality and the validity of the Patient Protection and Affordable Care Act in March, which is just a couple of months away. And finally, what can you do in all this context of all the political chatter, the presidential elections, the judicial challenges? What can you and what should you be doing right now? Not only working with your patient advocates, but working with your lawmakers, working with those in the advocacy community, and ensuring not only that your voices are heard, but to make sure that as we implement this very controversial, this very, very complicated new law, that your constituency is best represented, and the coverage and the disparities of care that you've encountered in the past, make sure that those voices are heard for our policymakers now and in the future. What can I do as an individual? What can we do as a coalition, as a group of patient advocates? And perhaps most importantly to me, what can you do as a community? I think that the greatest asset that you have is that you have strength in numbers. You have the opportunity right now, as the government is wrestling with these questions of whether the statute's legal or not. You live in all 50 states. Be it, this is the southern region, but those of you in your affiliates, those of you in your different chapters, you have representation in all 50 states. My assertion is that it is so important right now that your voices are heard. That your voices are heard with your state representatives, those who are looking at the legislation at the state level, implementing an exchange benefit program. How are we going to run it? What is the minimum that we're going to have of services that are provided? Are we going to have preventative care? Are we going to have ambulatory care? What level of care going up to the ceiling are we going to have? And at a baseline level, what baseline services should be provided, will be provided, or in your opinion, must be provided? Those are very difficult questions that need to be answered now. The advantage that you have right now is, and I hate to say it, this is an election year. And this is a very political, silly season time of the year. But it's also a great opportunity for you to engage. All politics is local, as former Speaker of the House Tip O'Neill used to say. They want to hear from you. They want to hear from your patients. They want to hear from your advocates. They want to hear why it's important as we are putting one of the most sweeping pieces of legislation into law that certain baseline provisions need to be covered and up to a ceiling need to be covered. And that's not just in your state capitals. That goes to Washington. There are very few bills that are going to pass in Washington, D.C. this year, but if two of the must-pass bills are going to be of a nature that involves healthcare. One is the PDUFA reform bill, or the Prescription Drug User Fee Act, that deals primarily with regulation within the FDA. That is a must-pass. It has to get reauthorized this year. President Obama has to sign it. Well, Washington being the way that Washington is, anytime that there's a must-pass provision, you will find lobbyists, advocates, concerned citizens reaching out to their legislative representatives and saying, I know this bill has to pass. We had a health insurance reform bill that passed last year. We need health care reform. Perhaps we didn't get enough as it relates to preventative services. Perhaps we didn't get enough as it relates to research and development. Perhaps we didn't get enough flexibility at the national level to allow our states waiver programs, flexibilities for the medical home model. You all know what works best for those advocates that you represent. And the time for you to reach out and to write the letters and make the phone calls and to have that level of interaction is right now. Because if you don't, I can tell you what's going to happen, because this used to be my world. You're going to have a bunch of staff people sitting around in Capitol Hill. You're going to have a bunch of bureaucrats sitting around in HHS and the other regulatory agencies in Washington thinking, well, we know what's best. We think we know how this is going to work. No. Don't allow them that opportunity to write regulations and to pass legislation that could adversely impact your interests. If you have the opportunity to meet with your representatives in your local communities or in your local capitals, go. Many of the advocacy organizations that you're affiliated with have legislative fly-ins that go into Washington, D.C. in the spring, and they meet with the representatives and they meet with your senators. Go. Tell them what works. Tell them what needs to be fixed. Tell them what needs to be added. Because the other thing that you've seen, and it really gets on my nerves about Congress's inability to work and to function together, is these silly 2-month extension bills. Well, right now we're in a 2-month silly fixed bill as it relates to the payroll tax extension. But we have an SGR fix, the doc fix, and you're talking somewhere, depending on who you believe, around $245 million that needs to be addressed of a shortfall. You hear leaders in Washington right now saying, we need a sustainable, multi-year solution for the doc fix. Well, doc fix, health care, health reform, opportunity for you to engage and say, I know there are really 2 trains that are leaving the station this year. It's going to be PDUFA reform. It's going to be the doc fix. Why aren't your voices being heard? Why aren't your concerns being addressed? And these particular mechanisms that must be passed. And I say that not to you as a challenge, but I say this to you as an opportunity. This is the opportunity, I think, that you have been granted that won't come along for a couple of years. They are intrinsically and inherently listening to you because they want to be reelected. But they also recognize that the current structure and the current bill, the way that it's been written, is very complicated and very complex. And they want a way out too. And you can help them get that way out. You can provide the way forward for them to learn from people who are most afflicted by many of the conditions, by many of the disparities that exist in the United States that all of our tax dollars are going to fund and going to provide funding for. So with this, I will end the formal portion of my remarks, and the most enjoyable aspect for me is to engage in the question and answer, and kind of hear what's on your mind and some of the things that we should be doing or things that folks shouldn't be doing. But enjoy yourself here. Enjoy the opportunity to make new friends, enjoy yourself, and have the opportunity to renew old acquaintances. But be a sponge. Soak all of this up. I love this personally. I've been doing this for 4 years of not only going to the regional PALS meetings, but going to the national PALS, but talking specifically with you, the advocates, because I always come out of these meetings all fired up thinking, oh good, look, now here's an idea, here's something I hadn't thought of, here's something that they should do, that but for the structure provided by PALS, and we thank our friends from the AIDS Institute for providing the structure and the leadership. Thank Mike Cohen and his group, the Executive Board, for the PALS Advisory Council. But most importantly, I thank you for your interest and your time and your participation. Thank you very much. Thank you for the honor and the opportunity to speak.
Hi, I'm Christian Clymer. I'm from Pharma. New ways to communicate and get our messages across with members of Congress. And so what's really neat now, kind of in the place where I am in my career and where the world is that a lot of this is now kind of all these different expertise are coming together. And I want to tell you a little bit about particularly how to be an advocate in this era of the social news cycle. It matters. These things matter because in this world of social media, in the new online and new social news cycle, word travels very fast. It travels broadly. And then finally, it's permanent usually. These kinds of things that once they're said, they can often be found later in Google searches. So you have to be very mindful about once something is said, either being able to engage it, manage it, or somehow deal with it. So today, really what I want to talk to you about is kind of understanding the power of this medium, understanding its increasing popularity with elected officials, and why now is a great time to use it to engage elected officials. And then finally, how we're kind of getting involved in it at Pharma and how we're using it as an association, and just some things that you could probably do too in ways that we can potentially help in the future. So first, let's talk a little bit about elected officials. Members of Congress, and they're really, what we found is that what members of Congress are doing in this arena applies to state legislators as well. But really the number one thing that they're doing with social media is using it to gauge public opinion. It's a new way. You know about the letters, the emails, the faxes. Well, this is another way for them to kind of keep their finger on the pulse of what's happening in their district. Because we're in an age now where you don't have to go and look for news. It comes to you. And so if we're not a part of that messaging, if we're not a part of that news that's getting delivered to people, we're missing out. And like the biggest likelihood is somebody else's is getting in. So this is a great way to be able to engage them, because it's eliminated a lot of the barriers that you deal with when you deal with staff and you deal with other people that surround a member. If there's someone who's using it themselves, it's a great way to engage them, a great way to get in front of them. This is a tool that improves communication between citizens and members. They also have a more positive view of constituent communications because of social media. Because it's a great way for them to be able to organize and see it and categorize it and look at it. This is a place where the people that we are trying to educate are getting their news and are getting their information. So if we don't have our news and information here, then we're missing out on a gigantic opportunity. We're learning who's driving conversations, who are the people that are really driving news about our industry online. What are the words they're using? So we're looking online to see how people are talking about our issues so that we're using the same words that they're using. And so now we're having the same conversation instead of having conversations next to each other. And then we're looking to get where they get their information. So what are the sources of that information? And then it's about building quality content. If you don't have something good to say in a way that somebody wants to listen to it, then it's kind of a non-starter. So it's about building good content. And then it's about creating your own news stream and network. Creating a reason for people to want to come to you or for them to want to see you in their Facebook feeds, because they know that you're going to have quality news, quality information that gets to a lot of the points that you heard earlier from Steve, where you're talking about honest information that's very precise, very factual, and gets your point across. So, and then you want to then build conversations on key issues. What makes this news cycle social? The fact that it's not just one way. It's about both broadcasting what you would like people to hear, and then if they have something to say about it, talk back. Find ways that you create not just two-way communication, but sometimes 6, 7, 8-way communication around an issue.
We talk about the Key Contact Advocacy Program. This means the legislative advocacy that provides local expertise so that you can speak intelligently on issues from the same page other members of your organization are talking to other representatives and senators about. We're all telling the same story. The success of the organization with the Key Contact Advocacy Program depends upon the activity level of the key contacts. You want to be active, you got to be active on the local level before they get to Tallahassee. And the key contacts must know the policies and the issues of the organization. Communication is critical. There's got to be a central person, whether it be your president, your director of governmental affairs. Someone has to be the central focus, whether it be your legislative chair, your legislative committee, so that when they disseminate information, it is given to everybody the same. What you are, what we are a source of information to them. They can't possibly know everything that comes before them legislatively. Transportation, healthcare, other issues. They don't know it all. So they rely on you in your specific area as the expert. That's what we call you, the key contact individual. When it comes to HIV, AIDS organization, how does it affect that population? It does not mean as much as your advocacy, your advocates right here in this room, calling that senator's office, speaking to his or her aide and saying, this is Steve Wynn, and I want you to know on House Bill 443, the Florida Osteopathic Medical Association opposes it for the following reason. That's it. Now, when we say that, we're representing an entire entity, as you are. We talk about calling on the phone. Probably the best of all. Why? Emails, they're real easy to get rid of, not read. Letters are another good item to send, but telephone calls are the best. You speak to somebody most of the time, and if not, you leave a message and they'll call you back. Letters are very important because usually they'll open up the letter. So we work with the staff, we send this to the staff and to the legislator, we make a telephone call, which is a third hit on the same issue. And if we're successful, after we give them the information, we send them a thank you note. That's 4 elements that we've used on one issue. I'm a constituent, not just a hired, paid lobbyist. I'm there for a different reason. I'm not there because I'm being paid to be there. I'm there because it affects us. And the thing is, we must always keep in mind that the person who has the vote is on the other side of the table. And he or she may not vote with us today, but they may vote with us tomorrow or the next day. This is one of many issues that will be coming before that individual. We call the 10 B's to remember when engaging with a legislator. Always be prepared. Be realistic. Be accessible if there are additional questions after your meeting. Be honorable. Be like. Be different. Inform your legislator that you are a constituent with important issues that affect his constituents back home or her constituents back home. Be assertive, knowing what you need to explain and how committed you are to that issue. Be brief because their time is very valuable, as is yours. Be professional and always be careful not to ask for too much because you may get it. The 5 P's that we talk about in order to succeed in this process, we feel are preparation, precision, professionalism, politeness, and perseverance. And always remember, as something to keep in mind, that your word is your bond. Nothing could be more important in lobbying than your word.
So let me just talk a little bit about Medicaid. I'm going to try not to get too much in the weeds because my consulting business is in the weeds. We get into details and numbers and dollars and cents. And so, I'm going to give you some general comments. I'm going to kind of talk a little bit about Florida, and then, open for questions that I'll have to speak to as he talks about Medicaid. But to give you kind of where Medicaid is, here's your population right out in Medicaid. We split Medicaid up into 2 areas. You get Medicaid fee-for-service. That's where, the doctor, you go to see a doctor, fee-for-service, everybody probably knows fee-for-service. Then you've got managed Medicaid. And you can see right now, pretty close to a split. Now, if you look at CMS numbers, you think there's more managed Medicaid. The numbers I report to you are true managed Medicaid, meaning those companies are at risk for those patients. They're on a capitated basis. There's a lot of managed care out there we call primary care case management, which is where the doctors are still getting paid fee for service. They get a little fee, kind of act like a gatekeeper like you'd see in an HMO. But the reality is it's still fee for service. So if you kind of question those numbers, that's where it differs. Then you look at the demographics a little bit, you can see half of the population are children under 18. You got 25% adults, and then you've got your age disabled and your dual eligibles. when you're really talking about Medicaid, you can't overlook budgets. And it's been the crazy driving force. It was crazy when I was there. My first year, they said, okay, welcome here, you're gonna save us $254 million. I still remember the number, I still those too, because that's all you talked about, and that was the goal. Now, the states have been getting hammered, based on, when you look at Medicaid, I'll show you some numbers here, I think it might have it in there, but everybody talks about Medicaid, and it's just out of sight, it's a budget driver. The reality is, if you look at the states, they've done a great job managing Medicaid when it's their fee-for-service. What they can't control is the number of people coming into the system. So if you looked at drug costs, which that's what I'm the expert in, most states, you look at their net cost of drugs after rebates, after the pharmaceutical companies pay a tremendous amount of dollars in rebates. If you subtract that from what they pay the pharmacies, the net cost, they've been flat for many years. Since they started these preferred drug list and rebate programs. What's driving the cost up is the number of enrollees that are coming in. So when you look at Medicaid, Medicaid will be a health insurance option after all this is said and done. It's no longer what they call the safety net system. You're going to have this huge expansion from 36 million to 52. And then you've got this subsidy population raised up to 76 million. Here's a point that should just, as I talk to my clients about, okay, well, what are we going to do? How do we prepare? Should we be involved in Medicaid? Do we need to keep doing Medicaid? I go, you need to look at what's coming down the road. Medicaid will become the nation's largest insurance option, covering 25% of the total population over the next few years. Okay. Thank you very much. Appreciate it.